isolated, as exactly you point out. So I just want to draw people's attention, first of all, to what's happened in Ukraine, where the parallels are very significant. And we see that 650,000 doses of specifically polio vaccine to Ukraine in April last year. This is UNICEF. And then on a broader context, we've got the World Health Organization in 2023 again, describing they're on the move for health, defending Ukraine against vaccine-preventable diseases. And of course, when the balloon goes up, the pharmaceutical industry pounces, and the World Health Organization therefore saying the war has made it harder for people to get vaccinated in Ukraine. Obstacles include the displacement of populations, destruction of healthcare infrastructure, and disruption of logistical routes for delivering medical products. This profound impact raises concerns about the potential for outbreaks of polio, measles, and other diseases, and has prompted the need for innovative solutions to sustain access to immunisation. So first of all, they're completely ignoring whether or not people wanted to get vaccinated for anything in the first place until the conflict came along. And also the other thing being ignored is that all of this would be much easier if there was simply a cessation of hostilities, which seems to be a strategy that's never pursued by any of the parties involved because there's too much at stake. The other thing to look at is from this year, which is a report, well, widely reported actually, that the Pentagon apparently was spreading what's called misinformation or disinformation, effectively an anti-vaccine propaganda campaign to rubbish the Sinovac vaccine of China. And the way this is described by the Scientific American is that they say that now we know when health authorities were desperately trying to tamp down these fears, the Pentagon was running its own conspiracy operation to discredit vaccines just so it could score points against China. The revelation is a worst-case scenario story for the global public health community, says Caulfield, because it demonstrates that anti-vax misinformation was being spread by the government and it reinforces people's distrust in institutions. Well, that's one way of interpreting it. I think I might say that in actual fact, this is probably more related to corporate greed, and in actual fact that by suggesting that the Sinovac was problematic, was not only pushing people towards vaccines made by different manufacturers, but also reinforcing the idea that anybody that considers any anti-vaccine sentiment of any sort is a lunatic and should be treated as an extremist. But also we want to look at the sort of the known harms, and just a reminder, therefore, that Gulf War syndrome clearly, an ongoing thing being reported here by the Department of Veterans Affairs in America. But again, the absolute opportunism expressed by the pharmaceutical industry, even when no substantial threat can be evidenced. Of course, the pressure on the system to vaccinate completely unwitting members of the armed forces. And as Vanessa's just been talking about, the vaccine-derived polio from Syria, of course, an enormous body of evidence suggests that polio is caused by DDT in the first place, and that it's actually the vaccine that does the harm on top of that. But then the last thing to look at is the manufacturer and who stands to gain. Again, this has already been alluded to, but the manufacturer in this instance is Biopharma, which is actually an Indonesian state-owned business. But of course, they are in strategic partnership with the Bill and Melinda Gates Foundation. So that's how that circle is squared. I dare say this, as a modus operandi, will absolutely persist, and we'll be seeing it rolled out across all zones of conflict under the banner of an emergency, which requires medical intervention, as we've seen a lot over the last few years. Now, that takes us back to the United Kingdom, and